Well, why don't we go ahead and get started? And thank you everybody for joining us. It's so nice to see everybody on Zoom, especially when I get to see your faces. And Melody, thank you so much for spending time with us after what I know is a very long day for you, and all the great work that you do for the community and for Virginia Hospital Center. So I wanted to, we are kicking off these forums to bring information to our friends and clients about the Arlington community. And we're kicking it off with Melody, with a very illustrious professional at Virginia Hospital Center, an important part of our community in Arlington and around the Northern Virginia area. So we are going to be doing these regularly, bringing non-related real estate topics to you so that you can learn more about our community and the important things going on that are relevant to your lives. And we will also be always available to talk about real estate whenever you want to do that as well. But today we're going to talk about COVID. And I want to introduce Melody, who is our Virginia Hospital Center Senior Vice President, Chief Nursing Officer. She serves as the transformational leader to the hospital's approximately 1,000 nurses and the many certified technicians, pharmacy, and respiratory therapy staff she oversees. Her work directly influences the Virginia Hospital Center's strategic direction and ensures that patients' care, service goals, and initiatives are aligned to the organizational success. She has also been instrumental in bringing a critical care unit into the Virginia Hospital Center. One of her goals that she had achieved with all of the typical speed and effectiveness, because she's a very effective leader at the hospital. And we are so delighted to have her. She has many accolades in her background, as well as previous experience at other hospitals. So we just feel so delighted for her to be with us today, and also just to be part of the Virginia Hospital Center leadership team, especially as we go through this unexpected pandemic. So let me turn it over to Melody, and she's going to explain what the hospital is doing, as well as she's going to talk about the trials that they're involved in. And then we want to have an opportunity for people to get their questions answered. Any questions that you have about COVID, so we can get to the facts, because I know we hear a lot in the press, and it's a great opportunity for us to hear right from the source of someone involved. So Melody, let me turn it over to you.
All right, thank you. Thank you, Marybeth. Thanks for having me. I'm honored that you would think of me to do this first presentation. Certainly, COVID is the topic of the day. It's been all-consuming my life for the last few months. And so kind of let me give you an update on where Virginia Hospital Center is. You know, we got our first COVID positive patient in early March. When I think about how much the whole landscape of care has changed in really a short period of time, it's really amazing. When we got that first patient, the whole state of Virginia could run 50 COVID tests per day for the whole state. Okay, so you would get a patient who had the symptoms of COVID, but as we all know, there's lots of symptoms for COVID. And so there's a lot of other diagnoses that could also be COVID. So some of the patients that would usually come into the hospital, think sickle cell anemia or congestive heart failure, all have symptoms that are very like COVID. Now we have to treat them like they have COVID until we know otherwise, okay? So we would send samples off to the state, and it would take upwards of about 5 to 7 days to get a result. So from that first day that we got that first patient, 5 days later, we had 30 patients in the hospital who we called PUIs, persons under investigation, because they have COVID-like symptoms. We can't say you do have it. We can't say you don't have it. So to keep everybody safe, we're going to treat you like we know otherwise. So that went on for some time. It got a little better as the state relinquished, the government relinquished control of those tests. and other vendors could do that for us. The second week of this pandemic, I'm really proud to have helped lead the opening of the first drive-through testing site in Northern Virginia. We stood that up in 5 days. We walked the site with the county. The county had an area that they thought would be a good fit for that. We walked it with our IT team, with the county's IT team. We did all the programming that's required to feed into our system, set up a scheduling format so that we can take orders and schedule patients. It was truly remarkable. And I think, one of the things that, makes Virginia Hospital Center so unique is that we're a standalone site. We don't have a large system that's overseeing us, making decisions for us. As a leadership team, we can get together, we can make decisions and quickly take action. And that drive-through clinic was just a perfect example of that. The reason for doing that was absolutely selfish on the part of the hospital, in that I knew if we didn't do that early, that all the patients who wake up with a sniffle, it's allergy season, it happens. Everyone who thinks maybe possibly they have COVID would end up in my emergency department. Our emergency department is small for the size of the hospital. It's an area, once we get that outpatient pavilion built, we plan to expand, but to layer on the potential volume for COVID testing, we knew we could not do. So we opened that site. Just through that site, we have tested over 5,000 of Arlington residents. It was close to Arlington County residents. You had to have a physician's order, and we made it very accessible to everyone. It has been a model that when Maryland and DC were going to set up their own sites, they called us to find out how we did it. And so we were proud to be first. Testing in the very beginning was the largest challenge. The other challenge that we had was all the changes. Every other day, if you were following the news, the CDC adjusted their guidelines just a little bit. So we were very fortunate that we've never had a severe shortage of personal protective equipment. But I really think that's because very early on, even before the epidemic hit, that we were planning ahead. And we decided very early on that our staff who were caring for COVID, or at that time COVID suspected patients, that those staff would wear an N95 mask. That was a big deal because, every hospital was concerned about the capability of continuing to keep that going. And we all heard about the shortages and whatnot at that time. And so, as a leader, I was anxious about that. But we implemented an excuse per the CDC guidance and the manufacturer's recommendation. You can wear that N95 mask up to 5 uses. And so if I put a use is considered whenever I take the mask off. So our staff could wear it like half the day, take it off, eat lunch, and then put it on and wear it the second half of the day. And we would cover it every time we would go into a patient's room with a just plain surgical mask. That has really helped us to be able to, one, keep our employees and our patients safe, and two, really prevent us from ever getting to a point where our staff felt anxious that they weren't going to be protected. We know that we were one of the earlier hospitals to do that and make that decision for the N95s, because we would have physicians that have multiple privileges at other hospitals, and they would come tell us that, it wasn't happening everywhere. So we're really proud to have been one step ahead in making that decision. As a result, our infection rates among our employees, when you carve out the employees that have never come in contact with a COVID patient at work, who their transmission was because someone in their family got COVID, or they visited someone who had COVID, or they went overseas travel and came back and in their quarantine got COVID, when you extrapolate those folks out, and you just look at our employees who have actually taken care of patients, our employees are at 0.02% infection compared to the general population, which is somewhere between 2 to 4%, depending on where you get that data. So we know that what we've done has been working, and if we're protecting our employees, we know we're protecting our patients. The big game changer for us was two things. One, remdesivir. We were, Virginia Hospital Center is a teaching facility, but we don't really do clinical trials. We don't do medication trials or equipment trials usually. But because of our affiliation with the Mayo Clinic, we were able to become a study site for remdesivir. So remdesivir is the drug that you're hearing about that is now has evidence written towards it that says it reduces the duration of the virus. So instead of being sick for, on average, 15 days, it reduces that time to about 10 days. That may not sound significant, but I mean, it really is. And because we were able to get to be a part of that study, we also were one of the first sites in Northern Virginia and even the state of Virginia that got the Abbott rapid test machine. Now, rapid means 45 minutes, but when you think about, remember, early March wasn't that long ago, when you had to wait 5 to 7 days to get a result. To get a result in 45 minutes was positively transformational. And it happened at exactly the perfect time. We were ramping up, and there was a day where I had 30 patients who we didn't know if you were or you weren't, 30 patients and 3 confirmed positive. And the next day we were able to take that 30 down and cut it in half, because half those patients didn't have COVID. We were able to move them to other areas of the hospital, and then we were able to isolate those patients that truly had confirmed COVID altogether. Now, we're not creating COVID units because we're scared that somebody's going to get infected because they're in a room next to someone who has COVID. We're really doing it so we can make best use of our personal protective equipment, and that we can have staff who are very comfortable taking care of this patient population. These patients are sick. It's, really if you're in the hospital with COVID, you are very, very ill. And we treat them a little differently than you would normal patients. So one of the things that we found through, this was literature that was specific to other respiratory illnesses, but our intensivists in our ICU really said, I bet this would work for COVID patients, is we started prone positioning patients. So prone position means that I put you on your belly. And if you're like me, I can't sleep on my stomach. I would be a terrible COVID patient. But for some reason, that laying patients on their stomach and doing that for several hours in a 24-hour day, around 16 hours in a 24-hour day, really helps prevent those patients from ever needing to be placed on a ventilator. So, mid-March or so, I was really worried that we were going to outgrow our ICU. When we started doing this therapy, we found that we were intubating less patients. And once a patient gets on the ventilator, unfortunately, the prognosis is very poor. We celebrate every time we get a patient off the ventilator, and we're successful, 2, maybe 3 times a week. But for the most part, those are the ones that really struggle, and they have really long hospital stays. They're on a vent normally. So to contrast a normal patient who might have like an asthma exacerbation who ended up on a ventilator, that patient might be on a ventilator for 1 or 2 days. These patients are in the hospital on a ventilator for weeks, like 3-4 weeks. It's a really long time. And so we celebrate when we get people off the ventilator and they do recover, and we have had patients recover. But preventing that ventilator is the key to a good outcome, is what we've seen. So once we got that testing, we were now able to really maximize our bed capacity and move patients over. And as the governor lifted the restrictions earlier in the month, I just have to figure out when it was exactly, we began bringing back some elective procedures. So, we all think of like a knee replacement surgery as being an elective procedure, but when you put off that surgery that you needed to get done 6 weeks ago, at some point, it's not that elective. You can't walk. And we know that when patients can't get around and take care of themselves, that they're more at risk for illness. So we really needed to open that up. And so when the governor and the state decided to do that, we were really fortunate that we had that Abbott rapid test and were able to start testing all patients. So this is not happening at all hospitals, but Virginia Hospital Center, it's something that we really have believed in, is that we test every patient who we are going to admit or who is going to have outpatient surgery or any kind of testing or procedure done. We're doing that because unlike really any other illness I can think of, you can be asymptomatic and be COVID positive. And since we've been doing this for a few weeks now, what we found is that it's surprising how many people are asymptomatic and COVID positive. And our, women who are, been taking care of themselves, they're pregnant, they're nearing the end of their pregnancy, they've been doing everything just right. Surprise, they, sometimes they're positive. And so, the fact that we can know that from the get-go, if you're having an elective procedure, then, it's probably best for you to wait and make sure that you're not going to get sick from COVID and then come back when your symptom, they're not even symptom, they don't have symptoms yet, but they could become symptomatic. You just don't know. So wait until it's passed and then reschedule the case. Obviously, you can't hold off having a baby if it's time. So, we have an entire wing that, we isolate those patients and keep them separate from the rest of the population. But we found about, between 1.6 to 1.8% of patients are asymptomatic and COVID positive. I just have to say that, I'm very proud of our team. I've always said that Virginia Hospital Center is a very special place. The people that are there, the leaders that are there, have a commitment and a passion for patient care and quality and just, give it everything. And it's been amazing to see the leaders come together during this time. It's been hard work, but very rewarding. Our staff morale remains very, very high. The outpouring of support that we've gotten from the community has been positively amazing. I don't know what we're going to do when the meals stop. We have people delivering food every day, and the staff love it. We all joke about the COVID-19 being the 19 pounds that we're all going to gain with all the food. But, it really helps them to feel the love. I've gotten cards from Girl Scout troops and some of the sweetest cards from some of our youth in the neighborhoods. And believe it or not, I photocopy every one and put it in my Monday message that goes out to all the nursing staff so they can see that, they're not forgotten and we're all working hard. But that the community is supporting us means a lot, greatly. So we are today, so our highest volume of patients was a little over 100. Today we're hovering around 80. I hope we really started trickling down about the last week and a half. This week we've kind of plateaued a little bit. My opinion on that and that of our infectious disease groups is that, this is a result of people getting out and about and traveling a little over the holiday weekend, and really getting a little loose on the social distancing and wearing a mask. I think in general, as things open up, it's really easy for folks to become complacent and start thinking that I just want to get on with life. And believe me, I want to get on with life. More importantly, I want to get my hair done. And that's going to happen eventually. But now is not the time to ease your guard. Certainly we can follow the guidance with the restrictions, but the most important thing that everybody can do is to wear a mask. If they're going to be out in public, wear a mask. If you're wearing a mask and the person beside you is wearing a mask, you've reduced your risk of contracting COVID or giving COVID by about 70%. It really does make a huge difference. Wearing gloves and that kind of thing doesn't really make a difference. The virus isn't absorbed through your fingertips. It really is absorbed through your mucous membranes, your nose, your mouth. Where you get into trouble is if you're wearing the gloves or you're in the grocery store and you're gathering things and then your eye itches and you scratch your eye. That's where you need to worry. But the mask is of utmost precaution. Hand hygiene is of utmost precaution. Keep your hand sanitizer in your purse and use it often if you're out and about in the community. And if you're where folks get tricky is they go out and they think that they're not going to get close to anybody, and then all of a sudden someone's closer to you than you would have thought they would be. Maybe you're on a walking trail or something like that. So I know the masks are uncomfortable. I hate them as much as anyone. We are masking all our inpatients and all our employees, and everyone's wearing a mask at the hospital. We've limited visitation. Really, the only visitors that are allowed would be if you're having a baby, you're allowed one support person to accompany you for the birth and to stay the entire time. And we are obviously end of life. We are allowing visitors for those situations as well. But that decision alone was probably the hardest one that I personally had to make. It's been, I think, probably one of the hardest things for the nurses to see someone who's just struggling. Maybe they're not even dying, but they're just, they're struggling. Because we have patients in the hospital who aren't COVID, who, have cancer and, other life-threatening things going on with them. The nurses are doing, they're that support person now. And, we have iPads, we schedule meetings with families so we can get as much interaction as we can. But any one of us, if we were in the hospital, we would want to have the support of people present in the room. And so I look forward to when we're able to lift those restrictions, and hopefully if things go down in the community so that we can get to phase 2, we can definitely revisit that.
Melody, do you mind speaking about you touched briefly on the trials and the tests in our Mayo Clinic. Do you mind going into a little more depth on that?
Yep, certainly. So again, we were part of the remdesivir study. I guess it's been about 3 weeks ago now that they released preliminary findings from that study and found that it reduced the duration of the illness by about 5 days. Now, the study was really looking at the effects of remdesivir on critically ill patients, okay? So they had to be in the ICU, and many of them were on the ventilator. And so we know the outcomes for those patients are very poor anyway. So the fact that it, actually made an impact on that group is really encouraging. Now it has been released by the FDA for emergency use. So the trial itself actually ends on Friday. But sites could end their study early, which we've done, and we've shifted the study drugs to our regular patient population. And so now what we're doing, because we don't have enough of this drug for everyone, no one does, is we are now able to give it to patients who are less ill. So they're not in ICU yet. They're still receiving like high levels of oxygen, but they're breathing on their own. And we're really excited to see kind of what it does. You know, if we give it to you sooner, does it shorten the virus even more? You know, that's the thing about this whole epidemic is there's so little we know about this entire virus that we're still learning. But again, if you think about where we've come in such a short period of time, it's what happens when the smartest minds in the world are all working towards a common cause. The other thing that we have been really excited about is convalescent plasma. So convalescent plasma is where if you've had COVID and you've recovered from the virus, I think it's 2 weeks after you have tested negative, that you could go and you could give blood at the American Red Cross, and they could take the plasma out of your blood, and this is plasma that contains antibodies. Okay, and so the thought is that these folks have antibodies where they fought off the virus, and if we give it to someone who's struggling, maybe they need more antibodies to get better. I won't go so far as to say it's not working, but it isn't transformational like I think we had hoped. So we continue to give it. There's certainly no harm in it. And again, it's still such a small number of patients who have actually received it, because you have to think about how many people have gotten well, had a confirmed diagnosis, and actually gave plasma. It is a donor a specific product. It's a 1 dose. Remdesivir is 7 to 10 doses, depending on how ill you are. And so, that's kind of how the two treatments differ. I think we're all looking forward to a vaccine. The latest that we've heard is, human trials are starting. Obviously, they've got to get people who are willing to take the vaccine, and then they're going to give them some of the virus to see if it actually works. If everything goes perfectly in the fall, we would have a vaccine. Who knows, how the government will distribute that. Your guess is as good as mine. I'm sure there will be a lot of control to that. But I would anticipate that it would be widely used until probably first of next year.
Melody, we have a few questions in chat. So Zach is asking, there are reports of 20 to 30% false negatives on the testing. Would you mind addressing that?
So there's two types of testing. There's antibody testing, and then there's the Abbott COVID test. So they did release a study recently that was some preliminary data about the Abbott test. And so I would say that what I've heard from our infectious disease doctors is that, the sensitivity of the test, if you test positive, then you really are positive. There is a percentage of false negatives, and we think it's more like 10 to 20%, and that's where a physician, you need their clinical judgment to determine if someone has the virus. So the Abbott test is what we call a PCR, point of care. It's similar to the type of test that you would get for strep throat. Okay, and so I don't know about you, but this has certainly happened to me. I go to the doctor, I have white patches on my throat, I have a fever, it walks, talks, smells like strep throat, right? But they do the strep test, negative. Okay, so does your doctor not give you any antibiotics because you got negative on the strep test? No, at least my doctor didn't. They gave me antibiotics, I got better. And I treated myself like I had strep throat. I stayed at home until I was fever-free for 24 hours, and all was well. So the same thing applies with COVID. If you come in, when we do that COVID test, we are also doing other tests. We're testing you for every other respiratory disease that we know of. We're testing you for flu because the two viruses are very similar from that respect, and a few other things. And so we get the COVID test and we look at all these other things. If you don't have any other thing and your symptoms are like COVID, then we tell patients you need to treat yourself like you have COVID, isolate, and we'll treat you in the hospital like you have COVID. So that's kind of what I think. Now the antibody testing is something that we really don't know that much about. So the difference between the Abbott rapid test and the antibody testing is that the Abbott test tells us if you have an active virus and you're ill, or it could become ill, because again, there's a wide range of severity of illness for COVID. If you are antibodies, then what that does is it says that you've been exposed to the virus. So what does that mean? That is literally the $1 million question, or $1 billion question, because it could mean that you got just enough of the virus that you got a little ill, but you didn't, maybe you just didn't get enough of it and you just didn't get ill, but if you got exposed again, maybe you would get sick. It could mean that you're immune, because again, that severity of illness is so wide. So, there's a lot to learn about the antibody testing. I'm glad that, all over now that they're doing antibody. They need to do more of it so we can learn more, so we can determine what to do with that information. If you've ever had like a hepatitis vaccine or MMR, and you became an adult, oftentimes your doctor will check to see if you have a titer, to see if you need to get re-immunized for that virus. That's really what we're trying to figure out with the antibody test, is how much of it do you need to have to truly be considered immune. So the benefits of doing the antibody testing is it tells us how widespread it is in the community. But that question of does positive antibodies equal immunity is something that I don't want anyone to leave here tonight thinking that that one equals the other. We just don't know at this time.
So Melody, thank you for that great explanation. Rovan and Vivian are asking, what kind of support do you have for your nurses and other staff in terms of managing their stress?
So we've done a lot. I think the thing that we have done is manage the stress of our employees the most has been really transparent communication. Okay, so we have, I started, early March, doing at that time, because everything was happening so quickly, and the patient population was just going up so quickly. I was doing it daily, 7 days a week. But it would be me and our head of infectious disease. We would do the call together. Now we're doing it 3 times a week. But I have about 80 to 100 nurses who call in for these calls. And so I take questions from the staff, and I've answered every single one of them. Trust me, some of them I did not want to answer, but I answer every one of them. And we provide an update because the staff want to know, how many patients, and they want to know about their coworkers and that kind of thing. So we share all that data very transparently with our staff, and that has helped relieve a lot of the anxiety, because now they know, and knowledge is power. We have set up because patients do die of COVID, and 95% of the patients who have died of this disease in our hospital have been over the age of 60. Over like 80% of them are over the age of 70. So the aged population has certainly taken the brunt of this this virus, and the death toll. That's been very hard for the staff to see that. You know, it's not unusual for someone to die in the hospital, but to see so many with the same thing, it just weighs heavy on their heart. So in our chapel, we've set up boards and a base for note cards and rocks that they can paint on, and ways that they can express that remorse and that loss of life in a way that's meaningful for them. And then we've been doing these what we call gatherings. And these are led by our behavioral health specialist and our palliative care team. And we schedule them for about an hour after the typical shift change to give folks time to get home. And this is an opportunity for them to call in if they're struggling and they want to attend a virtual group setting. And so, you know, that's been well received, and we have a call line for our staff as well. But, you know, the staff tell me when I'm around in the hospital all the time, they really speak to that communication that, we've been transparent when, we were like, oh, we have disposable stethoscopes that we use in isolation rooms. Well, of course, because, every hospital in the country is experiencing more isolation patients. All of a sudden that kind of snuck up on us. Oh my gosh, we only have a few days left of stethoscopes. We were able to make a change, but the staff, because we've been constantly communicating, they understood why we were making the change. They understood, that the change we were making was evidence-based and that it was going to keep everybody safe. And, they made, they had no issues with that. We've included them every step of the way as we've tried new things. So you've got, the N95, we got these fancy respirators. They're huge. And we tested them out with the nurses and several other staff. And they didn't like them because they weren't on the bridge of their nose. But then we took them down the ED, and the ED nurses loved them. So, I've been able to give options for staff. And some people wear the N95 half the day, and they wear the respirator the other half of the day. That way it gives their skin a break in different parts of their face. That has been easy. But just keeping the lines of communication open and giving them an outlet to express their emotions has been very, very powerful.
Melanie, it sounds like you've really been doing a lot with your staff, and it's paying great dividends. That's wonderful. Hey, from Kent, what's the average age of the patients who tested positive for COVID? And then he's got a follow-on after that question.
Gosh, I don't know the average age off the top of my head, but I know it's probably over the age of 70. Yeah, we've had some young patients as well. I think our youngest that tested positive, not that was ill, he was one of those asymptomatic patients coming in for a procedure, was 17.
Well, and the follow-on is, have the COVID patients been shown to have vitamin D deficiency? And is there anything that you would recommend to strengthen our immune system to protect against COVID, like taking vitamin C or other supplements?
No, I have not heard that. And so, I'm sorry, I would have to defer to one of my physician colleagues for the vitamin D question. I don't have an answer for that one. That's not one I've heard.
Maybe we can do a follow-up with you on that one, Melody. And then from Rachel, how about the new diseases linking kids to COVID or other syndrome? How can we protect our kids?
Yeah, so I think, the same way we protect ourselves. So, mask them as much as possible. And I've seen this in my own neighborhood, families that have chosen to kind of ignore the social distancing when it comes to their kids. And, I'm a mother of 3. I can't imagine if they were little having to go through this when they have all that energy and all they want to do is play with one another. So I'm not going to pass judgment. But we know that it is, we've heard the news that there is a new virus. I did ask if we've seen any of that in our area, and our physicians in the emergency department have not seen that. Now that isn't, I think Children's has reported that they are seeing some of those patients. So maybe folks are just, going to that specialty hospital to seek that treatment. But, hand hygiene, wear a mask, and, try to keep them isolated as much as we can.
Nice, thank you. So what, are you seeing any change in how children are affected by COVID? Are you seeing any different symptoms versus adults?
No, I did ask my emergency department physicians that this afternoon, and I have not, we have not seen any changes. The volumes have been very low for children. I can only think of two, honestly, that I recall, because usually I get a call from the nursing supervisor if we were to get one that would be sick enough to be admitted. So no, I think their symptoms are very similar to what we're seeing in the adult population.
And then what's your recommendation if someone starts feeling the symptoms, the COVID symptoms, what's your recommendation for how to do home treatment? If they're not sick enough to come to the hospital, but do need to take care of themselves.
Right. So if you want to get tested and just know for sure, then you could go through the drive-through clinic, and we'll, be able to give you that diagnosis. Usually results come back in 24 to 48 hours. But the most important thing for you to do is to self-isolate. So ideally, what that would look like is you would stay in a room like your bedroom. You kick your spouse out to another room of the house, and you would have your own room and bathroom. Your family could obviously bring in food and bring everything to you, and just sanitize the daylights out of your sink area and the bathroom where you're touching a lot of things or spitting in the sink and that kind of thing. Definitely, use a lot of your just typical Lysol wipes, or a diluted Lysol spray would be a great way. Just wipe down those solid surfaces multiple times a day, and then treat your symptoms. Eat well, drink lots of fluids, lay on your stomach, because we know that works. So, lay backwards in the bed and watch TV that way. If you've got a TV with the footy grid like I do. It's only if you really start becoming like extremely short of breath to where, you at rest, you feel like that you are just short of breath, and definitely come to the hospital. We'll take great care of you.
Thank you. Thank you for that good advice, Melody. So what you have been so generous with your knowledge and your expertise. So we thank you for that. What can the community do for the hospital? How can we help the hospital in this time of need?
Well, what I don't think, people realize is that, this epidemic has taken a huge toll on the hospital's financial bottom line. We were really fortunate that when the order came out, the state order, and everybody stayed out of the hospital. I was thankful for that, because, it gave us time to, get our processes down pat and figure out how to take care of these COVID patients. But there were units that I had to shut down because we ran at 97% capacity prior to COVID. And so I had 4 units closed at one point. That's about 100 beds. Now the good thing is I was able to take those staff and have them to help out on those other units and whatnot. So I'm not complaining. But there's a financial toll to COVID in all industries, but healthcare is certainly one of them. We care for medically ill patients based on the other work that we do, the surgeries and the other treatments and that kind of thing. So, we have a foundation. Virginia Hospital Center is a not-for-profit 503B facility. We're not part of a large system that's going to come bail us out. We are a standalone community hospital. And as a result, your financial support through our VHC Foundation would be so very appreciated. Any donation makes a huge difference. I know Marybeth is a member of our Galen Society. I would encourage all of you to become a member of the Galen Society. Dr. DeLisi and I have been doing videos together. He's our Chief Medical Officer, all throughout this COVID pandemic, sharing everything that's happening at VHC, which like what we're doing tonight, for the last several weeks. It's a great way to keep up with what's happening at the hospital as we're building our outpatient pavilion, which is going to provide parking, among other things. We want to be your community hospital, and we would greatly appreciate your support.
Thank you, Melody. We have one last question. Can you carry the virus on your clothes? And is there any truth in the advice that you should remove your shoes and change your clothes as soon as you come into your home? That's from Robin. And thank you for asking that, because I know I would have hung up on this call and said, oh my gosh, that's the one thing I wanted to ask too.
Right. So, what they're finding is that the virus doesn't live off of clothing and that kind of thing, as it's not easy to contract that way. I don't remove my clothes and my shoes before I come in the hospital. Now, if I was doing patient care and walking in the patient's rooms and that kind of thing, I probably would take my shoes off and change scrubs, but I'm not going into the patient rooms or whatnot. So I would say, there's no need to do that unless you visit someone, for some reason you need to visit someone who is COVID positive, and, you were to go in their house or something like that, then I would certainly take those extremes. Otherwise, hand hygiene, wear a face mask. I'm telling you, it would save the world if everybody would do those two things. It's the best way to prevent infection.
Awesome. Thank you. Melody, thank you so much for spending this evening with us. I have put the foundation website just in case anybody's interested in finding out more about VHC Foundation. You can certainly ask me, since I'm a member of the Galen Society and the Women's Health Circle Advisory Board as well. And it's been one of the most rewarding experiences to interact with people like Melody and Dr. Delicio and so many other talented members of the staff who take such good care of us in our community. So with that, I just want to remind everybody that this session was recorded, so you will be able to see it. We'll post it, and so I know I've got friends who couldn't make it tonight who do want to see the recording. So we'll get that out to everybody and posted on our social media pages and then on our website, so you can have access to it or send it to your friends as well. But thank you so much, everybody, for joining us and spending the evening with us. And again, applause to Melody for being so generous with her time and her information and putting some of our anxiety at rest with some of these questions that we've been carrying around with us and getting different answers in the media and not really knowing what was fact and what was fiction. So with that, I'm going to sign off and say good night to everybody.
Thanks, Marybeth.
Melody.
Bye. Thank you.
Thank
You
you.
rock.
Thank you.
Bye. Thank you.